So we're all thrilled to see you here today. We have a wonderful agenda. First, I want to tell you about the publication at your seat, which is our 2009 annual report. In the report, you find a lot of numbers demonstrating our impact, both in terms of the people we've served, as well as the program outcomes. And we all know, and the funders are sitting up front, numbers are important. But behind each number is a unique family story. And in the report, we highlight 3 families, and you see them also in the middle of the table on our centerpiece, who've received services from Invest in Children and tell in their own words what those services meant to them. I'm really happy that today Damaris Melendez was able to be with us, our medical home mom, so I want to say thank you to her for allowing us to tell her story. I know the Atkinson family at this moment is welcoming a new arrival, so they sent their greetings, but we knew it was going to be touch and go for them, and the Robinsons as well had hoped to be here, but I know you'll appreciate reading their words in the annual report. I also want to mention that you should be sure to pick up this latest issue of our Cleveland Federal Reserve Bank's magazine called Forefront. In it, you'll see there's a very compelling piece on early childhood entitled "Stop Investing in Stadiums, Start Investing in Kids," which details the economic sense of investments in early childhood. You know, for all of us in the early childhood field, having prominent economists now championing our cause has truly changed the conversation we can have with both our private and public sector leaders, and we're so grateful to them. So make sure you get a copy of that. Now, I'd like to share a few highlights of a wonderful and most productive year. What makes Invest in Children truly special is the strength of the system that we've built. And while we have needed to modify the system somewhat due to tough economic times, with support from both public and private funders, we've been able to maintain it and even enhance it in certain respects. We've always said the front door of our system was our newborn home visit program. We were dismayed when this program was a casualty of the last state budget process. However, motivated by our evaluation results, which clearly demonstrated this program's impact in both addressing medical concerns in mother and baby, as well as connecting families to the other services in our system, we were able to maintain the program in a modified form, first using stimulus dollars, now with Health and Human Service levy dollars, and funding from the Mount Sinai Healthcare Foundation. The Cuyahoga County Board of Health now serves as lead agency, and this year began delivering a nurse home visit to mothers on Medicaid giving birth at Metro, UH, or Huron hospitals. And there are already many, many stories accumulating of the impact of a nurse getting into the home early, seeing moms, identifying moms who are depressed, and getting them connected to other services. We hope one day we'll be able to return this program to its universal focus, serving all first-time mothers in the county, which is the way it used to be. But we know that the program is currently serving a population at risk and really making a difference. So we're very happy that it's still part of our system. There were other changes at the state level affecting Help Me Grow's ongoing home visiting program. A reduction in state funding and narrowing of eligibility meant that many high-risk families in need of support of a home visitor were not going to receive services as they would have been able to in the past. I'm pleased to report that Health and Human Service levy dollars, again combined with Mount Sinai Healthcare Foundation funding, have allowed us to continue to serve a broad range of families at risk. And with support from the Treuhaft Fund, we've been able to maintain a hospital-based child find specialist to identify families in need as soon as possible. This year, our medical home pilot, which provides a patient advocate to low-income new mothers to help them navigate their healthcare setting, provided us with some very encouraging program outcomes. In the general Medicaid population, the percentage of families who get their children to all well child visits during the first year of life stands at about 40%. In our medical home pilot, 86% of the families kept all of the visits. This means babies receive immunizations and lead screenings on time and have a truly established medical home. Quite simply, this model works. We're so grateful to the St. Luke's Foundation, who provided funding for this very successful program over the past year. Now, our universal pre-kindergarten program, funded by Health and Human Service levy dollars in conjunction with a federal appropriation and supplemental grant dollars from the George Gunn Foundation, is in its 4th year of operation. In just a minute, you're going to see a video showing you much better than I can tell you what a wonderful program it is. Evaluation tells us we're making a real difference for children attending one of the 24 UPK sites, getting them ready to succeed in school. We've expanded our continuum of services focused on getting children ready for school with the addition of a new lead agency this year, the Literacy Cooperative, which is implementing an evidence-based program called SPARK, which means Supporting Partnerships to Assure Ready Kids. Generous lead funding and support from United Way, as well as support from the Jennings and Stocker Foundations and PNC, has made the replication of SPARK in Cuyahoga County possible. This home-based literacy program for preschoolers is being implemented by Family Connections and complements our other efforts in this area, so we're delighted to have been able to enhance our continuum of services. Across all of our programmatic efforts has been an underlying commitment to evaluation. We're deeply grateful to the Cleveland and Gunn Foundations for supporting our evaluation component that is led by Doctors Claudia Coulton and Rob Fisher of Case Western Reserve University. A grant by the William J. and Dorothy K. O'Neill Foundation allowed us to undertake a strategic planning process with the Center for Nonprofit Excellence. Through this process, which engaged many of you seated here today, our stakeholders who we reached out to for your input, we're examining how to achieve even greater efficiency and further enhance our system. Final recommendations will be forthcoming, and we look forward to sharing them all with you. We're also pleased we're just beginning a new collaboration with Cleveland Bridge Builders on a project to research the feasibility of creating a kind of certification process to identify family-friendly places in our county. This effort is going to help us continue to progress towards our goal of a community committed to children, and we're delighted that Bridge Builders selected this project out of many that were submitted to them as one that could really have a long-lasting impact on the community, and I think a couple members of our Bridge Builders team are here today, so we're thrilled to be working with them. So you see that our system has remained strong because support from both public and private sectors has remained strong. Within the county, Rick Werner and Jim McCafferty have been extremely supportive of me and the work of Invest in Children. We have an absolutely extraordinary advisory group, the Invest in Children Partnership Committee, co-chaired by Leslie Dunn and Peter Lawson-Jones. This group of civic leaders provides advice, support in so many ways, from resource development to advocacy. They're always there when we need them. Whenever I need advice, I need to complain, I need to vent, I know who I can call, and I can't say enough about them all. In addition to the funders that I've mentioned already, I'd like to also thank Eaton Corporation, the Early Childhood Endowment Fund, the Griswold Family Fund, and Kaiser Permanente, who've also contributed to our funding base in the past year. And of course, I have to talk about our stellar lead agencies who work closely with us and really are the backbone of our system. Help Me Grow, led by Melissa Manos, the Cleveland Department of Public Health, led by Matt Carroll, the Alcohol, Drug Addiction, Mental Health Services Board, with Director Bill Denahan, the Cuyahoga County Board of Health, led by Terry Allen, Employment and Family Services, with Joe Gautner at the helm, Starting Point, with Miss Billy Osborne Fears leading the way, and the Literacy Cooperative, the new kid on the block, led by Bob Papinetti. Working with our lead agencies are over 50 private nonprofit providers delivering high-quality services to children and families throughout the county. So by now, I hope it's clear what we mean when we say that Invest in Children is a successful public-private partnership. What lies ahead next year? As you know, we're about to experience a profound change in county government. We know that the state budget process will be a difficult one. That's why our local commitment to maintaining our nationally recognized early childhood system is so crucial. Cuyahoga County has something to be proud of. We're recognized throughout the state and nation as a community that stepped up to the plate and built a comprehensive early childhood system. Last December, I had the opportunity to describe Invest in Children at the National Conference of 0 to 3. The main question I got at the end of my talk was, how? I mean, you should have seen the puzzled faces around the room after I described what we do here. How were you able to do this? And you know, there's no simple answer to that, but as I've reflected upon it, I would say that the answer is in this room. So, if you'll indulge me for just 1 minute, and I want you to get just a little bit of exercise. If I describe you, will you please stop eating for a moment and stand up? If you're an elected official or on the staff of an elected official, or if you're a private funder of Invest in Children, please stand. Elected officials, staff, funders, please stand. Okay, stay standing. All right, so from you come our resources, right? Okay, if you served on a committee of Invest in Children, helped us with planning, ideas, program development, any committee of Invest in Children, please stand. Everybody stay standing. Please stand. Okay. If you work for a lead agency or in the Office of Early Childhood, or you work for a service provider of Invest in Children or have received services from Invest in Children, you please stand. Our service providers and the people we do it for, okay? Now, and last, if you believe that every child in this community deserves the best possible start in life, please stand. Okay? So now you've given yourself a standing ovation, which you deserve. Okay, thank you. So, your why Invest in Children has succeeded. Be proud of what you've done and what we've done together. It's true that the children are our future, but it is also true that we are theirs. They're depending on us. We can't and we won't let them down. Thank you. So in just a minute, we're going to premiere our new video showcasing our Universal Pre-Kindergarten program. But before we do show the video, I want to recognize my staff. The wonderful, hardworking staff of the Office of Early Childhood who not only made this meeting possible, but make the work of Invest in Children possible every day. Bob Stabe, Magda Gomez, Helen McCoy, Marcos Cortez, Nakia Robinson, Anja Abdullah, and Mary Delaney. And in particular, Magda and Mary have just done an amazing job attending to the seemingly endless details of putting this kind of an event together, and you all know what I mean. So a special shout out to Magda and Mary. Okay.